me, I'm Jen G, the Vice President of Member Advocacy for IC360. We also have Tony D'Agostino, our CEO and founder. And we also have joining us today is John Lynch, who is from USI, who is one of our partners for IC360 ECE Healthy Advantage. So welcome everybody. One little housekeeping note too, if you guys do have any questions, please use the the Q&A feature on the webinar, and we'll try to address as many as possible. But again, welcome. Today we're going to talk to you more about our new IC360 ECE Healthy Advantage. And as some of you might know, we have been working on this development for over the last year to year and a half. It's something that we all know that all of us need in our industry, and we're very happy that we've been able to roll this out to not only our members and also to be able to offer this solution to non-members. So we'll go over our introductions. Like I just said, I introduced Tony and John and a little bit more about the partners that we are working with on our solution. We work with not only USI, we're working with SBMA, who offers the benefits to us, and then we're also working with Core Enrollment Solutions. We're going to go over a quick overview. We'll discuss the different benefit plans so you have that. Also cover some of the additional plan offerings that our new solution will roll out. We'll dive deep in, not too deep, but we'll dive into the program elements, the benefits administration, and then next steps to get you guys started. So as I said, our partners, you have us, Inspire Care 360, who we are your trusted partner if you're a member. We are here to support you. We are your extension of your back office. And as you know, we're here 100% of the way for you. We have partnered with USI, who is a broker. And as you know, or you might not know, but in regards when it comes to insurance, there's two people that can sell the insurance. So we've had to partner, we are basically your foundation to get you to this insurance. USI is the broker, which John is here to speak on their behalf. And then we have also we work with SBMA, who is the benefit provider. And they've been able to get all of our different policies or programs that we can offer you together so we can best show you the most value out of those programs. And then we also have Core Enrollment Solutions, who is the administrator to your benefits. So it'll also be, they are a key component to getting your programs up and running, to make sure all that administrative work is done. So that takes that off of your plate so you don't have to worry about doing all of the admin duties from payroll to your deductions. And they will also work with your staff when it comes to educating them on the different policies and programs that are offered with our Healthy Advantage program. So why did we choose to follow through and develop IC360 ECE Healthy Advantage? Like I had mentioned earlier, we've been working for a year and a half on this, and we know just because we have our own centers that there is a high need for healthcare in the different program benefits that you can offer your staff. With our industry, from having the low wages to the different aspects of staff that you have. You have some staff that might be able to be on their spouse's plan. You may have that can get from the exchange, but you also have that group of employees that might not have any coverage. So with our programs, we've been able to develop the different components to be able to bring you that, to offer those benefits to your staff. As we know, it's very important and a key component to making your staff not only feel valuable, but to help recruit and retain them as well. We have been able to create these flexible plan options for all needs, as I mentioned, even if it's, we've seen it from the 25-year-olds that are just off their parents' plan to, the 30-year-olds that might not think that they need insurance because they're healthy but really can't afford to go out to the exchange and pay for those premiums that are out there. And we've also negotiated the national pricing. Once we dive a little bit deeper into this and you see the different breakdowns of the programs that we offer, it's very impressive to see the pricing that we've been able to negotiate and pull together for all of you. And with, as I mentioned, with Core Enrollment Solutions, the unmatched benefit administration, these guys, there's nothing else to it than being able to sign up and work with these guys directly to be able to take on all that admin work off of your plate. And there's nothing else out there that can match that. And then obviously you have us, InspireCare 360, as your trusted partner. And that is one of the main things when we're talking about all of our partners that we have with us, is trust is a big issue, it's a big thing for all of us. We will only partner and work with different companies and associations that we know are going to give you the best value, that trust, and be able to execute to its fullest. And we move on to our childcare owner success model, where I'm going to hand it over to Tony.
Hey everybody, I hope everybody's doing well. Jen, thank you so much for the introduction on that. So some of you may have seen this before, and some of you, this might be the very first time. We believe that there's really a model for success in childcare. I'm not gonna spend too much time on this, but we're just gonna review it quickly. And this is the base of what IC360 has been set up and why is part of our vision and mission. We really believe that if you engage your staff, and in turn, with your staff engage, you engage your families, it is a key cornerstone to your childcare success. Second to that is the growth and enrollment of your organization. So through growth and you having an engaged staff, you will grow your enrollment, you will grow your reputation, and that is critical. Third is really about the opportunity to optimize your operations, save where you can, but gain the most opportunity within your existing operations. We believe that if you do these three key elements, you will be able to simplify your business, you will be able to prosper within your business, and you will be able to thrive. There's no better time than now to talk about the idea and the challenges that we have post-pandemic, as well as lockdown starting to happen again in some states, that we have to be extremely efficient. We have to sophisticate, but one of the things we do is we have to get off the gerbil wheel and not make the same mistakes of turning over top talent while we are trying to grow and bring families back in. So that's one of the key reasons why we're talking today. Today, we're going to also talk about a little bit about why this benefit fits so well into our space. We really have to look at the whole journey for when you recruit an individual to them having a career with you. If you look at this, you'll see from putting a job posting out there to recruiting them and actually bringing them in and interviewing that individual, to their onboarding experience, as well as what they have for their ongoing career. Benefits plays a key role in each one of those steps in that employee's journey. So when you look at wanting to retain and first attract, and then onboard and then retain top talent, having a solid benefit program that allows an individual to take a bit of a breather and not feel like they're there just for a paycheck, but they're there because it's part of what's going to be their career, is absolutely critical. And that's one of the key reasons we built this program, and we use it at our centers. So let's talk about the program. The Healthy Advantage program has 5 medical plans to offer. Okay, there is a dental vision plan that's included, as well as 4 voluntary plans that when paired together, it really does a lot to meet a number of the needs of the flexibility and the affordability we're seeking for our teaching and administrative staff. And in some situations, operators and owners take advantage of this too. So with that said, as Jen made a great point about benefit administration, this is part of the program, which we'll talk about later, but is giving you that large, what a corporate entity typically has is they have a benefit administrator. Many times small companies never have that. So the onus of enrollment or management or questions or claims or all those elements fall onto you or the back of your administration. So it's a really important part that we baked into this overall solution to try to alleviate what owners have going on. So we're going to go through the 5 different programs. One of them is a telemed program only. We've had that in the past, and we've now added our other 4 programs from the basic to the ultimate. Now, going into this, each one of these programs outside of the telemedicine option have a preventative and a wellness program that is part of them, and it's 100% covered, which is critical because, like Jen mentioned early, oftentimes individuals who come off their family plan who may not be on a spouse's plan, sometimes, especially when they're young, feel like they don't need any level of health care. And they skip a lot of the annual things that keep them healthy, that keep them well. There's a reason why these plans invest in wellness and preventative, because both the insurance industry as well as what it costs citizens like you and myself, it costs us tremendously more to treat as to prevent. So that's why preventiveness is in each one of these plans, including like annual physicals, including like mammograms or different cancer screenings. So it is really rather thorough when it comes to those preventative measures. So let's get into the plans and really talk about what is the difference, because these plans are not considered major medical plans. So when we talk about what's a major medical plan in your region, you may have companies like Blue Cross Blue Shield or Kaiser Permanente or United Healthcare or Cigna, and there's a whole bunch of different ones. And in your region, in every state, those have to be licensed plans for managing within that state. They have limited competition, they have limited needs to go outside of state, and so they often have to set up within different states their own entities, but that pricing, as we all know, is very expensive. On the left-hand side here, what you see is an example of one of the plans that we offer to our staff with my centers that I have, where we have a number of employees just at the part of just over 50 FTEs. So we offer a major medical plan. And this just happens to be a Blue Cross Blue Shield plan. Everyone's different. Even if it was in your neck of the woods, the pricing was likely different. But just to talk about it, this program has 0 number of minimum employees that you have to have. They used to have a minimum, but now they don't. Your employee contribution, and these are like, so, you know, would be as if you were self, just for the individual, or maybe it's with an individual with children or individual with a spouse, or a family altogether. And as you can see, there's a deductible here of $6,000, which is sort of typical right now for a plan that runs for an individual around $360 to $375 or so. What happens is, you obviously know, is with a major medical plan, is you pay monthly for that fee as an individual, all right? Your employer, or you, the ones who are probably viewing this as the employer, pay a portion of that. Typically, half is requested to be paid. Sometimes it's paid less, but oftentimes half of it is paid. And so those dollars add up significantly for major medical. And a lot of people don't take them because they oftentimes don't have that $6,000, with that $6,000 deductible, or even a $3,200 deductible. Those do not get diminished in a year, so they never really see a dollar come from those plans. They do include 100% of wellness, typically, not always, but they also have telemedicine, typically now, because it's a state mandate that these plans have have telemedicine. And during COVID times right now, they've been giving away no copays, but typically outside of COVID times, there are $49 to $79 copays that go on anytime anybody uses that. Then once you have completed and diminished your deductible, you then get to use the dollars for that insurance. So it's a very expensive plan, comprehensive possibly in state, but very expensive to use if you even use all of that. There are no setup fees and no monthly fees in these type of plans typically. But again, everything's a little different. Now let's talk about the plan we're bringing to bear. This is the IC360 Healthy Advantage plan. And let me give you a quick orientation of what you're looking at, because there's a lot on the screen. On the left-hand side, you're going to see that you're looking at what the owner pays as a premium. This is the minimum premium that they would tend to pay. And then there is for the employees down here, whether it be an employee plus spouse, with child, with family, these are the rates for these specific programs that are across the top. Here's a telemedicine plan, a basic, a virtual, an ultra, and an ultimate. And then down here are the different type of benefits at a high level view. So if you were to choose just a telemedicine program only, we still have, which we have been offering for our members, and there's also non-member rates here too, but for our members, there is a $10 a month per individual, and there is no cost to the employee. This is just to the employer, and there's zero copay and a discount card for pharmaceuticals. This is access to an MD anywhere in the United States, 24/7, right through apps that are likely right on, well, which are on your phone. But we look at the other 4 plans, which are really big about giving an option, meeting that need that major medical may be too expensive for, and possibly if they are given away on what might be the state exchange, some of the programs because of their level to the poverty level. So what this plan does is this is a really effective plan. You'll notice for the employee, for an individual, it starts at $45. That's only like $11.50 a paycheck, okay? Really inexpensive, and it covers 100% of their wellness. So this is a very basic plan, as it says, basic. But what it does is it gets people who feel like they're sort of impervious and that they'll never get sick. It gives them an opportunity at a very low rate to be in front of a doctor several times a year for different screenings. Then you see how, as these programs build, one of the things you're going to notice is the employer contribution monthly per employee is only at $25. You can pay more if you want to pay more of the premium for the employee, but it's at a minimum of $25. So that truly allows you to budget, and budget in a big way. This also goes, and let's go all the way to the ultimate plan here. You will see that in this ultimate plan, that the rates are very competitive for what you do receive. So with what you have here, you have, for instance, $120 for an employee. And then down there with a spouse or with children, all the way to a family for $360. But what you get for that from $1 with no deductible is you get a full wellness preventative plan. You get all your telemedicine included. You have $15 office visits for your primary care physician, $15 specialist visits. If you go to urgent care, it's $50. If you have an x-ray or specific blood work done or what have you outside of your physical, it is only $15. And you can see that highly competitive for generic as well as brand name pharmaceuticals, really competitive in these areas, especially when you're looking at named new brands for very specific types of medications that are needed. This is highly competitive in this realm. And obviously there's also behavioral health, which gives you a number of different visits with that. Also, the thing that is great about this plan is that it is very affordable and it's very flexible. It is not a major medical plan. Why is it not a major medical? Because it's not comprehensive in scope with your hospitalization as well as a few different elements. But that gets also covered in some of the voluntary plans that we're going to talk about. So if this is something that you are interested in, what we are going to ask is that you sign up a time to meet directly with Jen and likely John or his partner in crime, Tim, and they will get into the deep dive of details with you specific to what the program offers and what this element pays for, and compare it to some major medicals. Again, it's not meant to replace a major medical if an individual is using the full scope of a major medical. But if an individual doesn't have anything, or they have a major medical plan that they're never getting to the deductibles and they're never really being able to use it, and they don't have high risks, this might be a very good option for them. There are some other fees associated with it, and we're going to do a worksheet in just a second to give you an idea how that plays out. Again, I said this is going to be a busy slide, so my apologies for all the information, but that's the value of getting on a deep dive with a one-on-one with Jen and John. All right, so for our members, there is a non-member cost for some elements, and there's member cost. There is a one-time setup fee because we are setting up a number of things with our partners that Jen mentioned up front. There is an administration and a platforms fee, but you will see how that, though there's a monthly fee for that, that really covers a fee that replaces what you would typically delegate to your staff. So that pays for itself many times over on a monthly basis. It also gives all your staff an online application and tool to use for all their benefits. It also has, there is a fee for additional locations, and there is the $25 fee, which we talked about up here. It's the same fee from 25 here. There is a $10 minimum, but what that means is, let's say that you rolled this out to 15 staff members and 8 of them took it. There's a $250 minimum as to just paying 25 for 8. But compared to 25, 250 compared to just maybe paying for one employee on major medical, that hopefully you would see as a very good value. So let's do a quick worksheet here and take a look at if you were in a current situation, for instance, with major medical, and say you had 6 staff members who are just taking an individual major medical plan. This is just an example. So I don't want to portray this as this is how everybody's situation is, because it's not. But with 6 individuals, and let's say their premium monthly is $375 a month. Let's say that they have that $6,000 deductible we just talked about. And with that, if you were to take half of that $375 a month, that employee premium a year is pretty high at $22.44 per year. And then you look at the employer side of it, if they're taking that 187 or half of this for 6 individuals, they're paying $13,464 a year for their major medical to cover 6 employees. Inclusive of that, this employer, like myself, how I was before we rolled this out even to our own staff, I'm paying for all the time it takes for my staff and my multiple locations to administer the enrollment upon someone joining the company, making sure they get everything right, making sure they get the paperwork in a timely manner, making sure that it goes to the right person at the right time, that their program's in play. To help manage it, if there's any kind of issues, if there's any kind of challenges or claims or any of those elements, and then ensuring that all the deductions go through to my payroll company, whether they're going through my staff or right through with my bookkeeper. So this plan, for instance, on this worksheet is about $13,464 according to this scenario, plus the cost of my administration monthly that it takes to roll it out. This covers 6 staff. Let's look if you were to add IC360 Healthy Advantage and how that would possibly affect it. You can combine that obviously with some of your major medical plans. So in this scenario, let's say 2 of your staff members needed to stay on a major medical plan. So that's $375 a month, again, just like over here. But now you have 20 staff members take advantage of this plan. Some of you might have 1 location, so you might not have 20. But in this situation, we're just showing you how many people and what the real value of the program is. If, let's say, 10 of them chose that basic plan and 10 of them chose that ultimate plan, we have $540 a year per person and $1,440 per person who chose this plan. This is compared to the major medical at the $22.44. And then you look at what the employer premium is. You see the significant amount still for major medical since 2 people are on it, but Healthy Advantage for 20 is at $6,000 a year. What this adds up to, though, is you have the administrative and platform fee that we talked about on the other page. But when you add this all up, the total cost is $13,488. But now you're covering 22 of your staff members with the same program. And the more people who take this program, the less you likely have with your expense exponentially growing. And it's a great way to keep your staff healthy and focused, especially in these days of the pandemic. Okay, so let's look at this too, just as a reminder. your staff, it's not only about what you save as the owner, but your staff is paying that premium throughout the year, and then they have to deplete that $6,000 before they get $1 of insurance used other than wellness. Over here, they're paying $540 or $1,400 for the more elaborate plan, and they're getting to use their insurance from day number one, dollar one. Okay, big difference. So the additional benefits, if you want to set up that one-on-one, we're going to also be able to talk to you about how there's a wonderful dental vision insurance program, which basically gives you at a very low rate up to $1,000 a year for dental vision. And every time you visit, you have 80% of it covered. So if it's a $100 visit, you have $20 out of pocket, and the other 80 is covered from dental and vision. Very competitive, especially for a relatively healthy population. Accident insurance, obviously, if people or someone does get into an accident, whether it be hopefully not, but someone gets hurt at their home or at the center, or in turn is hurt in a car accident, all the associated costs that are aligned with this insurance will be discussed in that one-on-one. Then you have specific disease, and this is where it comes down to if there's specific ailments that, like diabetes or something of that nature, or lupus or what it might be, that is named that you can have specific insurance attended to. There is critical illness insurance. So if someone unfortunately was to get something of the nature of like cancer or something, it could be a very long journey, and in turn a lot of expenses associated with it. And that's what these very competitive cost of critical illness. And then the hospitalization really is something that can put together with the Healthy Advantage plan that you just saw. You could see where if you put a number of these together, you still may not even exceed for an individual $200 a month, but all the different kind of benefits that they can receive. And that would be more talked about on the one-on-one. Okay, so the program elements are, you know, these programs are for medical, the dental, vision, and the voluntary plans. And you can choose to have the medical plans or the medical plus the voluntary plans for the employees. The good part about it, again, for an employer is you are not having a lot of budget risk because you know what your minimal payment is of $25 an individual for these plans. Okay, who take it? If they don't take it, you're not paying the $25. If an employee is currently enrolled in a traditional major medical insurance plan, like a United or a Kaiser or a Blue Cross Blue Shield, when moving to one of these flexible plans, employees definitely, and this is what our benefit liaisons, which we're going to talk about in a moment, would help them think through, is what is the value, what do they get for it? So it's not major medical, but it is flexible and it covers a number of different needs. And then finally, with the IC360 medical plans, they are flexible benefits. So they give you options to lower your price for what you receive. So it's giving you options as to only having major medical is the one option. So with that said, let's talk about the benefit administration, sort of like the the whipped cream on top of the sundae. And when we talk about that is because we bake this into the overall pricing of the premiums that are part of the programs we already discussed. What this includes is the benefit administration that includes local enrollment, consultants, liaisons, that typically, if it wasn't lockdown days, they would be face-to-face with your staff, either in a group setting, group annually during an enrollment period, or when new staff enroll throughout the year. And they would walk the employee through what their benefit options are, but they're also going to look at if they are, for some reason, on a major medical plan, whether it be yours or whether it be a spouse's or whether on the exchange, what the different options are, what's covered with those plans as to what cover options they have. It's an eyes wide open type of approach. There's no value in us getting someone into one of these plans if they really need a major medical, but conversely too, if they're using a major medical plan and they're never being able to get to any of the insurance on it, this plan may make an awful lot of sense. Doing an annual checkup with everybody, handling all the benefit claims and questions. So really taking this off the back of your staff. It is paperless, it is streamlined. They have an application that is part of our program, and it's called Employee Navigator. Employee Navigator is filled out at the time of enrollment with the benefit liaison and your employee, and in turn, they Once it is filled out together, the employee has complete access to see where their benefits are 24/7 through a phone app, something on the laptop that allows them to know what their program is, what it offers, and what the options are. It also is something that this software will integrate with many different payroll providers. And we could talk more about that when we do a specific one-on-one if you're interested in learning more. And then also, as needed, is you get to have, as you need, participant reports, comparison reports, so you can really look at who's taking advantage of what and how it's benefiting your staff. So again, sort of in wrapping things up a little bit and bringing a bit of a summary to this, is IC360 Healthy Advantage differences. It has been built specifically for our marketplace. We looked at it because I really took a hard look in talking with a number of people that are on the Inspired Care 360 Steering Committee, which are all owners of childcare centers throughout the nation, along with my own childcare centers. We looked at what the needs were, and we really talked with USI about helping us pair a program together that meets those specific needs. We also looked at how do we make it where there's just not one program, but there's a flexible array of options. So when you do talk to a possible recruit, or you have an existing employee that you want to retain, you can have a number of different options. So they see that you have like a full offering benefit like a major company would offer. And negotiating national price. So what we've done is, because we have hundreds of centers from coast to coast that are with Inspired Care 360's membership, that has given us some negotiating power to be able to come in and be able to negotiate these rates down to very reasonable, affordable rates, and include the benefit administration as part of it. And then we just talked about the benefit administration is really sort of unmatched for small businesses of this nature. Sometimes you can find an inexpensive plan, but a lot of times when you find those inexpensive plans, there's not a lot of whistles and bells of support that go with it. And this plan is not only rich with its offering and affordable with its price, but has that additional value of the benefit administration. And we hope that everybody, we believe that we lead with trust at IC360. Like Jen mentioned up front, trust is really what the business we're in. And we only build our membership because we believe our members truly trust us and that we would go to the mat for them and only bring them the very best. We do know that everything's a bit of a journey, so sometimes solutions don't meet exactly everybody's need, and we want to hear about it, but we're going to do our very best to make sure it does, or look at bringing additional options in. So with that said, we are seeking to schedule one-on-one virtual meetings with John as well as with Jen. In those meetings, we're apt to get into your questions, to do more of a deep dive and a walkthrough and implementation of a timeline, what it would take to have it happen. What are sort of the steps that it takes? How do we, communicate with you to your staff if you did want to roll this out? What would be the process for the benefit liaisons to get together with your staff? How would they do that? How do you communicate it? And then how do you ensure everybody's up and running for a very seamless approach? And then you also learn more, obviously, about the financial structure. This also, two of the elements that I didn't mention, and John's probably just waiting to say, but one is this, for the most part, if you're going to file correctly, is pre-tax. So, and employees who have these dollars come out are going to have pre-tax dollars come out. So that's a big financial benefit for them. The other thing is for those of you who have what large employee status, so over 50 FTEs, full-time equivalents, and you're struggling to meet the Affordable Care Act, or you want a solution that's more effective to the Affordable Care Act, this meets a major portion of the Plan A part of the Affordable Care Act. And in turn, in this one-on-one meeting, it is an opportunity for you to learn what any kind of risk reward you have of rolling it out. But the fact that it does meet a major part of the Affordable Care Act, I think, is a critical value for this program too. The last part of it is you'll notice, because we're working with the benefit administration, and we're not just turning it on and turning it off willy-nilly, we're actually having to set the program up for you in a proper way. It takes us about a month and a half from the time we've actually said, yes, we're moving ahead and we have the right kind of documentation in front of us. So there is some runway to do that. And that meaning that like July 15th, any of those people who we do have a bunch of people who decided to join for September 1st. So their document had to be in by today. And because their documentation is in by today, they will be able to do a September 1st rollout. We are now looking at August 15th approximately for an October 1st rollout, as well as moving forward, as you can see, September to get a November 1st rollout. We do roll out on the first day of months to organizations. So we do look to try to get at a minimum that month and a half. But again, what is critical is we really need more than a month and a half because we do need to gather information from you to get it to our administrator. So with that said, we've come to the end of this presentation. I don't know if we have any question and answers. If you do have any question and answers for the group, we're more than happy to answer those, and please put them in the Q&A and we'll be glad to answer them. We also have the ability to, with our attendees, to look at if you want to use the raise hand function, we can also have you ask a live question. But with that said, if anybody has any further questions, I don't see any coming across. I would ask you to reach out to Jen. You have her contact information here, and ask for her if she would be able to set up a one-on-one. I know she will, and I'm going to ask her also to follow up with you directly too. So I want to thank everybody very much, and I want to greatly appreciate the time that we spent together today. Unless we have any other questions, John, do you have any other questions you have up for us today?
No, nothing to add, Tony. I think you did a great job reviewing the program. As you've emphasized to this group, this is a high-level overview, introductory in nature. Want them to understand where this fits or can fit in their overall benefit and HR strategy and employee attraction and retention strategy. So if you've got any lingering questions, by all means, we want to make sure we get those answered either today or in a follow-up session.
All right. Thank you so much, John. I really appreciate that. And Jen, thank you so much for kicking this off. Really appreciate it. And we'll talk to everybody very soon. Thank you.
Thanks, Tony.